My name is Sarah Raymer, and I'm one of New Jersey Regional Vice Presidents for the Committee of Interns and Residents. I'm also a third-year resident physician in internal medicine and pediatrics here at Rutgers New Jersey Medical School. That means that I, like all my resident colleagues, work up to 28 hours in a row and 80 hours in a week. And if you're wondering why there aren't more of us here today, that's because they're working at the moment. Without asking questions, we take care of all comers at our teaching hospitals, including the uninsured, the undocumented, and the unable to find help anywhere else. At 3 a.m. this morning, you could have found me in the pediatric emergency room at University Hospital working with an orthopedics resident to treat kids who couldn't get casts for their broken bones anywhere else because they didn't have the right insurance. That's where you'll find me again at 3 a.m. this morning or tomorrow morning, and the morning after that, and the morning after that. My colleagues and I do this kind of work for somewhere between $50,000 and $60,000 a year, depending on how far we are in our training. So you can imagine how jarring we find it when an institution that purports to be world-class can't manage to give us our step pay increases on time. Every July 1st, we all advance a year in our training and get a small pay increase in return. Most of us can see July 1st coming 12 months in advance, but apparently Rutgers and JMS cannot. For 2 years in a row, our pay increases have been delayed by over a month. Even when the administration acknowledged the problem this summer, it's not as if they apologized. Another thing that's been delayed is our personal employment contracts. We're supposed to sign them every year by July 1st. But for Rutgers and JMS residents, our contracts just became available last week. It seems like not having things on time or stalling is just the routine here at Rutgers. We can't get our grievances resolved in a timely fashion, and we do have quite a few grievances at this point. We have money that we get to buy meals when we're on call. Periodically, we lose it. We're not sure why. People who are supposed to get comp days for the holidays they work or paid in lieu of those comp days have had to wait over a year for those. People who go to conferences and submit for reimbursement per our union contract are also waiting up to 8 months for that money to come. That's out of a pretty small paycheck that we're already footing those bills. I wish I could say that I'm proud to have the Rutgers name for my residency program, but sadly, that's not the case. When Rutgers absorbed UMDNJ on July 1st, 2013, I was one of the people who had high hopes for the new Rutgers Biomedical and Health Sciences. I believe the administration who spoke of transforming RBHS into a world-class medical university. But after 14 months with Rutgers, I just need to ask all those administrators, are you serious? Is this how you become world-class? By treating the people who you want to make your institution great, not very great at all? If you don't treat the people on the ground, the people who are delivering the healthcare that you want to deliver to the public, well, how do you expect to keep attracting them?